Hey, preceptors. Welcome to week 9 of the semester. I don't know where time got to me. I just looked back and I realized that I haven't done an announcement in a month. So I missed 1 2 week window. I am sorry. I apologize for being a little MIA, probably because of the Katie site visit and all that stuff. So I'm sorry. I appreciate it. But here we are, week 9, ready to go. So let's start off with that. Some good and exciting news. So the Katie site visit went really, really well. Thank you so much for those of you that were able to be a part of it. For those of you that weren't able to be a part of it, you were there in spirit. I sent out that Preceptor thank you update video last week, so please take time to go ahead and watch that because you guys were identified as a strength of our program, and for that I am very, very proud and happy, and it makes me really excited to work with people that are committed to improving our profession, our students, just as much as I am. So take some time to watch that because you are identified as a strength, and that's great. Other good news, really good news. As you guys know, we are housed in the College of Education, but because we're a health profession, I sit on a committee with all the clinical education coordinators in the Pharmacy and Health Sciences College. And every single year, that college does a preceptor appreciation night where they invite their preceptors and they thank them. It's usually at a very nice place. I know last year was at the DIA. There's usually some appetizers and drinks, and it's usually a wonderful evening where all preceptors for all health professions can get together and socialize and be thankful. And so I am happy to say that we have been invited to the table, and you all should be receiving a save the date shortly to attend this year's Preceptor Appreciation Night. It's April 23rd, so if you want to slot your calendar right now, I think it's going to be at the Outdoor Science kind of center in downtown Detroit, which is kind of a super cool hip place. I'm excited and thrilled. I've been really, really pushing for this, and now it's going to happen. And so I'm just excited that you guys are going to be able to be a part of that event because you deserve it, because you work so hard for us and our students. So great. All right, so now let's summarize what's going on with the students. Second year's clinical immersion students, 1 month left, right? So they're really going through and kind of fine tuning things for the next month. If there's things that they haven't been exposed to, pushing them towards those or getting them those exposures. They just did discussion posts last week where they had show a resource that they've been learning and share it with their peers, which was great. You guys, all the resources that they provided are things that you have given them. So that was awesome to see that, how great you guys are doing a job of mentoring them. And then they also kind of had a look at their eValue case report to kind of see what areas that they still haven't gotten related to procedure codes. So that would be a great way to touch base with them and facilitate some conversation, saying like, hey, we got a month left. What do you want to get? What do you need? Because it's going to be over before we know it. With their transition to practice class online, they're really just working on BOC practice questions and preparing for that BOC exam. First years, we are upon mid-semester, which sometimes can be a meltdown, all right, depending. So you might see them a little extra on edge. With their rehab class, they finished lower extremity rehab, and I believe they have an exam this week or next week. Gross clinical anatomy, they're right smack dab in the middle of upper extremity, so they're working on that. Their integrative class, we did lower extremity case, like standardized patients in class cases, and then they just had an assignment where they had to write SOAP notes on those and create patient goals. We also did a modalities review, so a lot of them are going to be doing their modality competencies coming up. And then tomorrow we're actually doing the same case pathology except for upper extremity. So they are kind of really in the thick of it. Great ways to implement that stuff into clinical practice would be to giving them standardized patients or acting as a patient that has a pathology and having them go through and kind of diagnose you if that's not just naturally occurring, if you don't maybe have a lot of patients around. So that's summary of students. Other stuff, kind of a good amount of things. Evaluations for our immersion students, good, great, right? Their mid-semester evaluations were due, I think a week or two ago. Those were great. Those looked nice. Thank you. First year students, they're due a week from today, Monday. So they should be working on that mid-semester. So the student will do their mid-semester evaluation on them. You will do the mid-semester evaluation on them. And then you guys should sit down and have a face-to-face and kind of chat about that. So those are due Monday. Spring break is next week. Believe it or not, it's crazy. What I have informed the second years, the clinical immersion students, when they had orientation was you should treat this as how you would facilitate any conversation related to work and requesting time off. So I have left it in their hands and or your hands. If they want the time off, they need to initiate that and have a conversation with you and discuss that. If you guys are naturally off, I mean, just let the kids be off. That's fine and those things. But I'm letting you, the preceptor student, navigate that conversation because I think that's important for them to kind of understand how to do that. Most of them express that they're just planning on going because they're going to be done with the immersion experience shortly anyways, and they want to get the most out of it that they can. But just to kind of let you know, as far as the first year students, spring break, they're done, they're off, so they need to have that week off. They need to rejuvenate as far as all that stuff. Remember, they're hardcore into their content and their courses and stuff, so they need that week off. So please go ahead and make accommodations to give the first year students that week off for their spring break. Simulations, I just want to touch on. Some of you are working on those simulations with me for the clinical immersion. I've had a lot of clarity post Katie's site visit last week, and so I really worked on those on Friday, and you guys got those emails. So take a look at those. Really need to start writing the simulations and stuff like that and putting things together. So if you hadn't had a chance, take a look at that. But it's really great because the site visit helped provide a really clear picture for that. Evalu, if you guys haven't noticed, you might have gotten an email. They're updating their user agreement policy. So you have 15 days to log in, and then you just have to agree to that. If you don't do that within 15 days, then you're like getting kicked out and you're not going to have access. So make sure just in the next week or two that you log into eValue, you accept that user agreement so that way you don't get kicked out and then we have to troubleshoot that and you guys losing access. So yeah, that's everything that's going on in the program. A lot's there. But as you know, I like to end with a teaching tip so you can kind of see the image that's attached. And this is part of an article, but I went ahead and just threw that in. The article's about how to kind of go ahead and be a good preceptor, but they have this one part about tips for teaching on busy days. So you can see that there's many of them, but I wanted to kind of highlight a few that I thought were really nice and beneficial. So for that pre-planning, some key points were like letting the student know, like, this is going to be a really busy day, a really busy week. So they have an idea. Setting priorities, meaning like, these are the things that I want to get done today or we want to get done today. So that way there's that end goal in sight. And then having some other ideas kind of ready on the back burner if you get super, super busy and the student kind of maybe isn't able to help and assist. Maybe that's doing something with inventory. Maybe that's working on a home exercise program you haven't got a chance to get to, but maybe having some things in your back pocket that way for the student to kind of work on. For the ones that are under student time with patients, I like using the limits. Go ahead and start that patient, get them set it up, or go take a history, 10 minutes tops, right? And then you come back. So kind of putting that time limit on that can really go ahead and help with that. Another good thing for you, if you're, reviewing documentation or maybe looking at some data or some diagnostic tests or something, have the patient go ahead and greet the patient, get them started and facilitated, and that kind of buys you some time to kind of get things situated. For the next one where it has that case presentation time, and that would normally be what if a student was going to present a case to you. I, again, like the concept of the time limit. So even if they went and evaluated someone or they did something to come back and say, okay, let me know what happened, or give me a breakdown of what happened, 5 minutes. Put a limit on it, because that's also going to help condense and help them learn to determine what's important and what's not important. So I think there's a lot of value to that. And then for the last one, for the finding discussion time, I know that sometimes things are so busy that we don't. And so you think, oh, there's so much time, I can't even schedule something. But it's actually the opposite. If you actually schedule the time, even if it's 10 minutes, you're more than likely to have it. So if you've been meaning to touch base on something or have a discussion with the student and, the day gets busy, just be like, Monday, 1 o'clock, 10 minutes, we're doing it. And if you actually schedule it, you're more likely to go ahead and actually have it instead of just kind of waiting. And then be creative. Use times where we just kind of maybe take for granted. Like if you have a 10-minute walk down to the athletic complex, or if you're going to get a cup of coffee, maybe you say, hey, come with me. I'm going to walk next door. We're going to get one, and do that. Use that travel time or any of that downtime to go ahead and kind of utilize that. So many more tips on that image that you guys got. If you want the full article, let me know and I can send that to you. But I kind of wanted to pull out those big ones because we're all extremely busy, and it's the time of the year we're even busier and busier and busier. And so it's super easy to kind of go ahead and kind of not make things a priority, but I'm not worried about that because our preceptors were identified as a strength of our program. And so I'm confident, and I know that you guys will continue to do great things. So super excited. If you have any questions or need anything, just let me know. Thanks.